Primary sclerosing cholangitis, PSC, is a rare, chronic, progressive liver disease of unknown etiology, which typically affects middle-aged men. PSC can occur in different parts of the biliary tree and can lead to severe fibrosis and cirrhosis, as well as cholangiocellular carcinoma. Diagnostic workup of patients with chronic cholestatic disease and suspected PSC is a clinical challenge. In early stages of the disease, morphologic changes in liver ultrasound and blood parameters are not specific and therefore are not easy to interpret. Atypical perinuclear anti-neutrophil cytoplasmic antibodies are often elevated in PSC, but are also elevated in various chronic hepatic diseases, so that, lacking specificity, they cannot serve as a specific screening parameter. Overlap syndromes between PSC and autoimmune hepatitis make a reliance on blood parameters for diagnosis and staging of the disease questionable, and make further examinations to visualize the intra- and extrahepatic bile ducts necessary. Bile proteomic profiles provide information on risk of CCA development in patients with PSC, but do not help to distinguish PSC from other cholestatic hepatopathies. Magnetic resonance cholangiopancreatography, endoscopic retrograde cholangiography, and percutaneous liver biopsy are regularly used approaches for diagnosing the origin and severity of cholestatic liver disease. However, ERC and liver biopsy are invasive, associated with significant risk and unwanted side effects, and ERC is no longer the primary diagnostic procedure in patients with suspected PSC. MRCP, that is magnetic resonance cholangiopancreatography, is now the preferred diagnostic tool in patients who have not previously undergone intervention of the biliary tract. However, it lacks diagnostic accuracy in extrahepatic disease, is not sensitive enough in detecting intrahepatic PSC in early stages, and does not help distinguish between PSC and CCA or cirrhosis, thus increasing the risk of missing PSC or even CCA diagnosis at early stages. In addition, high-quality MRCP and experienced operators are not currently widely available. Therefore, Lutz et al. Evaluate the use of endoscopic ultrasound of the common bile duct in the diagnostic workup of patients with chronic cholestatic liver disease, especially suspected PSC. The findings of their prospective pilot study are reported in the October issue of the journal Endoscopy in a paper entitled Endoscopic Ultrasound as an Early Diagnostic Tool for Primary Sclerosing Cholangitis, a prospective pilot study. Primary sclerosing cholangitis is a rare chronic cholestatic liver disease which typically affects middle-aged men and is frequently associated with inflammatory bowel disease. Early recognition and accurate diagnosis remains a clinical challenge. Invasive diagnostic procedures such as endoscopic retrograde cholangiography or liver biopsy are needed when magnetic resonance cholangiopancreatography remains inconclusive. As these procedures are associated with significant risks, the current study sought to determine whether Endoscopic ultrasound, EUS, of the biliary tract is a useful diagnostic tool in cases of suspected PSC. In a prospective pilot study, 138 patients presenting with chronic cholestatic hepatopathy were screened, and 32 patients with possible PSC were evaluated further. In addition to all routine measures, EUS was included in the diagnostic workup. The following parameters were evaluated and compared with the definitive diagnosis: wall thickening more than 1.5 mm, irregular wall structure, significant changes of caliber of the common bile duct, and perihilar lymphadenopathy. In the 138 patients screened, a PSC prevalence of 13% was found. Of the 32 patients included in the study, 17 had large duct PSC diagnosed. When 2 of the aforementioned 4 parameters showed PSC-like features, sensitivity and specificity of predicting PSC were 76.4% and 100%, with positive and negative predictive values of 100% and 79% respectively. In 4 patients presenting with strictly intrahepatic disease, EUS was not diagnostic. The authors conclude, EUS proved to be a valuable tool in suspected PSC and accurately predicted extrahepatic disease. EUS should be evaluated further as an early procedure in routine diagnostic measurements. This approach promises a significant improvement in disease detection as well as a reduction in high-risk invasive procedures.